Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
If we say the whole thing is about blood flow, what is wrong with a lactating woman that her blood flow to the genitalia and the pelvis is diminished or less? Remember, when a woman lactates and there is milk coming out of the breast, and we also mentioned before, if in infertility sessions, if a milky discharge coming out of the breast, that's a sign for increase a hormone called prolactin. So a lactating woman, by normal physiology, this is normal physiology, is not like the pathology that we have in infertile women. This is now normal pathology. A woman just delivered, she has a baby, she is breastfeeding. Normally, her prolactin will be high. When prolactin goes high, that is an inhibitory effect automatically in some hormones in the pituitary gland. Don't worry about the names, but if you need to know, they're called LH for luteinizing hormone, FSH for follicular stimulating hormone, that will be inhibited. Those are the hormones that are coming from the brain. Like we said, sex is all here. So those hormones are inhibited because of the breast coming out of the milk, that prolactin that is causing the breast the milk to come out of the breast. That high prolactin decreases the LH, FSH. As a result, LH, FSH goes to the ovary that is low now. You have FSH, LH are low, and those are the stimulation for the ovaries. We have a small stimulation manifested by the small amount of hormones will give me small stimulation to the ovaries. That means estrogen will be less. So now, anything, as a general rule, anything that causes low estrogen from the ovaries will give me a state of sexual dysfunction. How? What is the relationship between estrogen and sex, sexual response, sexual dysfunction? Remember, again, it's all about what? Blood flow. Estrogen causes increase in the blood flow in the pelvic area. And if I have increase in the blood flow in the pelvic area and the genitalia is there, the whole sexual response is there, then it makes a lot of sense. I need to have estrogen in order for me to have increased blood flow, and that will give me good lubrication and good sexual response. So if I'm lactating now, I have increase in prolactin, I have decrease in FSH, LH, I have decrease in estrogen, I have decrease in blood flow that is going to the pelvic area, then it makes a lot of sense. This woman cannot be lubricated and cannot enjoy sex, and this is what we call temporary sexual dysfunction. Because once prolactin is back to normal, the FSH, LH is back to normal, and estrogen is back to normal, and blood flow is back to normal, then the sexual excitement and the arousal phase of the sex will be back to normal. The desire will be back to normal. So what about menopause? What is wrong with this menopause? Post-menopause woman is the same thing. What happens in post-menopause woman? The ovaries are shut down. So when the ovaries shut down, there's no more estrogen coming from the ovaries. So as a result, we have less blood flow going to the pelvic floor, going to the genitalia. I cannot have good sex because I cannot have lubrication, because estrogen is the normal way for me to have lubrication. I don't have any more estrogen. I have less lubrication. I have less blood flow. Because remember, blood flow is what is needed to go to the clitoris, and the clitoris is the most sensitive, area that is very much similar to the penis, but just smaller, a lot smaller. So in the man, we need blood flow. But we cannot say we need estrogen for the man to give me blood flow, because that's totally different. In the woman, we need estrogen in the vagina and in the pelvis to increase the blood flow. So what if a postmenopause woman wanted to have sex, or a lactating woman wanted to have sex? What will be the medical solution in this case? Well, it's very simple. Very simple. Estrogen has a systemic side effect, even though the benefits are much far greater than its side effect. So to avoid all the side effects of estrogen, I will just insert a small estrogen tablet in the vagina, and that will do the trick. Now I enhance the blood flow into the pelvic area, into the genitalia. I have better lubrication, and I can have better sexual response. That is an example to show you that yes, arousal can be compromised if the woman have low estrogen state. So in general now, anything that leads to low estrogen state will affect the woman's sexual response. And now we can have an arousal disorder in a woman that can easily be avoided if we understand how it works. Now, what about desire? How can I fix desire? Desire is fixed by psychotherapy. Remember, I said once before, sexual problems. I see a lot of young men, and young women. They already having sexual problems and sexual dysfunction. I just left the clinic, and I had at least 3 young men with sexual dysfunction. Young, I'm talking about 20s, 30s. This is very young. So the problem here is what? Doc, I used to have good sex 5 months ago, and now, 5 months now, since 5 months, I cannot. There is weak erection, and I cannot have sex. That's by the same token, I get women also complaining. But if you compare the number of men that complain about sexual weakness to the number of women that complain about sexual weakness, men is by far more. It does not necessarily mean that women do not have sexual dysfunction. The even higher, statistically speaking, they just don't talk about it because of culture, religious, or whatever reason, or shy, they just don't talk about it. So how are we going to fix the desire disorder, make the woman interested more in sex? Or how are we going to, whether men or women, how are we going to fix the desire disorder? Psychotherapy. What is psychotherapy? I talk, you listen. You talk, I listen. So if I talk, you listen, and you talk and I listen, we call that in one word, communication. Okay? So it's basically communication. So we can easily do that if the man and the husband and a wife, and a man and a woman can easily communicate. If he talks, you listen. And if she talks, you listen. Communication. Communication about what? What are we going to be talking about? We're going to be talking about likes and dislikes. Okay? Then you're going to tell me, but if the woman never had an orgasm, she doesn't even know what orgasm feels like. Then we're going to give the patient a little bit of education. And we tell her orgasm is just maximum pleasure, is pleasure, something nice that you will feel. And to prove to you that you have an orgasm, you're going to feel contraction in the lower pelvis. You're going to feel muscle contraction. You will feel different physiology, Some women laugh, some women cry, some women you will know when a woman have an orgasm. You will know, and the woman would know. If you never had experienced such a thing, you never had an orgasm. So You have to be educated what orgasm look like to tell me whether you have an orgasm or you never had an orgasm. So physiologically speaking, this is the normal body changes that take place when a woman have orgasm. So if you have already experienced those kind of changes, you already have your orgasm. If you haven't, you never had an orgasm. Now, what about for men? Men ejaculate. That is his orgasm. What is the difference between an orgasm in a woman and an orgasm in a man? A woman is multi-orgasmic. She can have multiple orgasms in one sexual intercourse, while a man can have only one, and he needs maybe half an hour, 2 hours, 3 hours, 6 hours. We call it the refractory period to regain power and have another encounter. So that is the difference between a man and a woman. So we spoke now about desire and how we're going to solve desire. Psychotherapy, and the key word in that psychotherapy, what we do is communication. I talk, you listen, you talk, I listen. And then we find, the solution. And the solution going to be found only if you tell me what you like openly. No, there is nothing hidden in a sexual relationship between a man and a wife. You tell me what you like, I know it. I tell you what I like, you know it. Let's put into practice. You do my likes, I do your likes. You avoid my dislikes, I avoid your dislikes. We're already successful. This is the first step on successful relationship. A relationship without sex, you fool in yourself. Because sex, good sex, is a very important part of a successful relationship between man and a woman. What can affect that beside this? What can affect that? So, what can affect this, I repeat again, if the woman does not know what gets her excited, what gets her to be aroused. She doesn't know. She never experienced such a thing in her life. She has no idea. And we said the solution to that is you get educated. What physiological changes you get during the arousal phase. The arousal phase, remember, you're going to be what? After proper sexual stimulation. Proper sexual stimulation. You cannot just have sexual stimulation doesn't mean intercourse. Sexual stimulation means the foreplay you do to stimulate a woman before intercourse. You will try to delay the intercourse as long as you possibly can. When a man feels the woman is lubricated, then the woman herself will ask for the intercourse. You cannot rush intercourse without proper lubrication of the female. That is essential. That is essential.